guys, this is Dr. V from Ghost Plastic Surgery. First thing you have to look, and when you look at yourself, is how good is the skin? Because you're really looking and examining two components. One is the skin quality in the area, and the second, is there any fat to suction out? In this candidate, as you can see, by just looking on the back of the arms, you can see right away two components. One, which is here, and we're going to show you this component a little bit later in different position, and a second component, which is right here. According to the laws of gravity, the skin is sliding and positioning itself on top of the fat. When we take a Flexsculpt and we do the Flexsculpt of these areas, we always have to think three-dimensionally kind of. The arm is a round shape, so we don't want to over liposuction or over Flexsculpt. We have those two areas of concern by the patient, and we easily recognize it. Now we reposition the arm and look at it again in this position, rather flexed at 90-degree angle. You see that this is area, even though it's not really much sticking out, that's an incredible problem. It's still a little bit discordant with the rest of the arm. So the Flexsculpt for this area can be administered in a very light fashion in order to bring this to this line and to this piece. Also, we're going to bring it back again. You can clearly see that this area is kind of dented. So what we want to really do for this particular arm is to Flexsculpt this piece, slightly Flexsculpt this area, and maybe administering the J-plasma or Renuvion after the procedure for the whole area to kind of tighten up the skin, make it a little bit tighter and a little bit more fitting in that particular area. We're always doing Flexsculpt, we have to take into consideration that again, the arm has more elliptoid or rather round shape, so it has a curvature here. It cannot be just liposuction like the abdomen and make it flat. Otherwise this is going to look flat just like this piece, which doesn't look really cute. So there is a special technique for the Flexsculpt in removing the fat pads from those areas. Also we have to take into consideration, once we play a tiny hole here and start working from this area, we want to make sure that this piece is not wrinkling or sliding down. So we don't want to see kind of flexure over there. Now let's examine again in this position. We're going to position holes rather in this area, so and hide it. And another one, most probably we're going to hide in a crease right here. So when the person puts the arms down, nobody would see it in the skin folds in this area, and you don't really see the hole right here. And that's what's the idea of cosmetic surgery. Now we have another patient. This lady is complaining that she has extra fat in this territory. And for you, even on a video, it seems to that there is quite some fat and I'm touching it. But if you reposition and put the arm right here, you will understand that this patient has weight loss and all this fat disappears. So all this piece that I'm going to mark right now is purely hanging skin. You can even see it and appreciate how wiggly it is, and there is nothing inside for Flexsculpt procedure. This is not a candidate for the Flexsculpt procedure of the arms. This is usually the candidate of the arm lift procedure. And this piece of skin have to be removed, this area have to be tightened up, and that's how it's supposed to look for the cosmetic improvement. So Flexsculpt cannot achieve any results in this territory, rather have to consult and explain what other options are. And in this case, the only option remain is removing that extra flap of skin and repositioning and tightening up this area. Now I have to tell you also one thing, that in this area, doing skin tightening procedures also will not work, because it's too much of its skin itself, of the laxity, it's too much of the territory that cannot be attended by less invasive procedures. So there is only one procedure remaining here, is to do an arm lift and cut this piece of skin, reposition that, removing this, and that's what the result that we might achieve after the arm lift. Again, no Flexsculpt procedure for this patient.